Ready to go? Dr. Morrison, are you ready to roll? Okay, well, good afternoon, everyone, and thank you again for joining us today. I'm joined by Dr. Morrison, our Chief Public Health Officer. Just wanted to offer a few comments at the beginning before Dr. Morrison gives us the most up-to-date health information related to COVID. But and I'm thinking as I pulled in early this morning that there have been many uneasy steps that we have made as a province since COVID arrived on our shores back in 2020, and I don't know if any of them have been as uneasy or as important as the steps that we made yesterday. Having over 14,000 island students and staff returning to in-person learning across the province is a monumental step and one that has taken an extraordinary effort by so many to be able to accomplish. And if my own household was any indication of what was taking place across PEI, I expect that there were equal parts of excitement and apprehension and an adjustment to a change in routine. I'm happy that from all early reports that things went smoothly. But we do know the days ahead will continue to be ones that are filled with a mixture of emotions as we make these cautious steps and continue to make them. We're confident in the processes that we have in place to react quickly and confidently to do the best we can to limit any spread that may occur. And when you look at some of the things that we are doing with regular testing, with additional measures in our classroom, masking and cohorting and contact tracing to the extent we can do it, our protocols are very, very thorough and perhaps as thorough or more thorough than most other jurisdictions in the country. But all of that can't and won't keep us from seeing COVID continue in our province, in our communities, and in our schools. What is critically important is that our students are screened each morning, that regular testing occurs. If anyone, whether it's a student, a staff member, or a parent, is showing any symptoms of COVID-19, they should go to a testing clinic and get tested. This is in addition to doing the rapid testing that we're doing 3 times a week for our students. As we said last week and have said repeatedly, we know that the best place for our students is in the classroom. And although some of the measures happen within the walls of our schools or our homes, keeping our students in class also depends on each and every islander doing their part and following the public health restrictions and regulations. Again, I feel it's important to say that, that I'm aware and I understand how tired we all are of this. And I think that's across the board, whether you're a strict follower of all the health protocols, whether you disagree with them all, or whether you have just done your best to do your best to make it better or a little bit better. I think it's been a long haul. You're all tired of it. I'm tired of it. Never before in the last 100 years have we had to do anything like this or to deal with anything like this. So you should be tired, and I know you're eager to be through this, and you should be eager to be through this, and I respect that. I'm aware of that. Dr. Morrison and I and her team are aware of that, and we're doing everything we can to get through this as quickly and as safely as possible. And we will begin to talk next week about what other measures there are to come and how we can continue to make our steps out of this. But today we will talk about where we're at with our COVID and our back to school. I would also say that just before I pass it over to Dr. Morrison, that last night I did have a call with Prime Minister Trudeau. We discussed potatoes, but also COVID-19 in our province. I did provide an update to the Prime Minister on our current landscape and our back to school plan, and also talked about some of the challenges that we are facing with the COVID situation in Prince Edward Island, specifically as it pertains to our long-term care and community care and the staffing and absenteeism due to isolation and positive cases that we're seeing in some of our healthcare settings. Right now, we're very, very thankful, and I told the Prime Minister this, that hundreds of people have stepped up and have taken on extra shifts and have done everything they can in this difficult time to make this as easy as possible in both our public and private healthcare settings. These individuals, it should be said in no short order, have been incredible over these last 23 months, and these last couple of months in particular have been extra challenging. And it's clear that, that they've given their part extensively, and we appreciate that. And they continue to be needed as we navigate the last leg of what we hope is the last leg of this journey. The Prime Minister did reaffirm that the federal government would be there to support us should we need it. We also know the realization that there are limited resources at the federal level, and there are resources that have been deployed throughout the country. But the Prime Minister reassured us that if things are needed from the federal perspective in terms of emergency relief, that they would be there to do what they can when they can, and we very much are appreciative of that. Our government has been working side by side with our long-term care providers to ensure individuals in our long-term care facilities are kept safe during this wave of COVID. And again, I want to say from the bottom of my heart to all of those and all of those families who are impacted by COVID in our province that we're doing everything we can to get you through this as safely as we can. But on that note, I will turn it over to Dr. Morrison to talk about COVID in our province and where we're at and where we might be going.
Thank you, Premier. Good afternoon. And it's hard to believe it. This is the first day of February, and although it's gone quickly, January has felt like a long month. And I think it's okay. The Premier referenced it's been such a tough time as we go into this 23rd month, and I think it's okay for all of us to acknowledge that it has been really tough for each and every one of us, as in terms of what we've done, what we've gone through, what we haven't been able to do. And you're certainly not alone in feeling that way. And I know the Premier and I share those sentiments. Having said that, despite the cases in the last months, the hospitalizations, despite this Omicron wave, I think we have more hope and optimism now than compared to even a month ago as we continue to manage our way through this wave of the pandemic. And I do believe we will be in a very different place in a few weeks. And by next week, I hope to be able to really talk about modifying the current measures, including easing of the travel-related isolation, allowing larger numbers for organized gatherings, enabling sports teams the opportunity to play games, and permitting individuals to participate in more recreational and cultural activities. In the meantime, we have more work to do to try to contain the transmission of COVID-19. We do have to continue to be careful over the next couple of weeks and not let our guard down. The next couple of weeks will be important as island children and staff transition back to in-class learning for grades K to 12. We know that COVID-19 is prevalent in all island communities in all age groups. As we spoke about last week, we'll all have to do our part to minimize the spread of COVID in the community. Keeping the transmission low in the community will help us keep children in school, because what happens in the community impacts what will happen in schools. While there are some early signs of being on the other side of this peak, the next 2 weeks will be very telling and especially important for our health system. Although Omicron is highly transmissible, it appears less severe than earlier strains, but it can still cause severe disease, especially among unimmunized individuals and older adults. Omicron is causing significant burden on healthcare systems across the country because of the large volume of cases and the fact that healthcare workers are among those getting ill from COVID-19. As of 8 o'clock this morning, there are 362 new cases of COVID-19 to report, bringing our total active cases to 2,225, and there were 289 recoveries since yesterday. Over the last 7 days, we've had an average of 226 cases per day. Presently, there are 15 people in hospital being treated for COVID-19, including 2 individuals in intensive care. In addition, there are 6 people in hospital who were admitted for other reasons and were COVID positive on admission or tested positive after admission. There has been 1 new death to report, an individual in the age category of 80 and over. And my sincere sympathy to the family and the loved ones who are mourning the loss of this individual. In terms of outbreaks, there are outbreaks in 7 long-term care facilities. There are outbreaks in 2 community care facilities. As of this morning, there are 20 early learning childcare centers with cases or outbreaks. 5 centers are open, 10 are open with modified or limited services, and 5 are closed. There are outbreaks in other congregate settings, including the population that access shelter and outreach services in Charlottetown, the Prince County Correctional Center, and St. Eleanor's House. The outbreaks at Miscouche Villa, the Provincial Addiction Treatment Facility, and the Provincial Correctional Center are now over. In addition, we know there are outbreaks at numerous workplaces across the province. As of Saturday, January 30th, 96.6% of eligible residents aged 12 and over have received at least 1 dose, and 93.4% have had 2 doses. 65.7% of children aged 5 to 11 have at least 1 dose of vaccine. The rate of vaccination among children aged 5 to 11 in PEI is above the Canadian average and is 3rd in Canada, behind Nova Scotia and Newfoundland and Labrador. However, it is concerning that the uptake among 5 to 11-year-old children has slowed considerably. I urge parents and guardians of children aged 5 to 11 who have not yet done so to make an appointment to have their child immunized, and please do so as soon as possible. This is especially important as children return to school and activities this week. The offering of COVID-19 vaccines in schools was postponed, and obviously the classes only went back in yesterday. So families are encouraged to book by calling the vaccine booking line or book online at Skip the Waiting Room. And clinic days for children are highlighted in orange. Being vaccinated is the best thing you can do to protect your child from serious outcomes related to COVID-19. The National Advisory Committee on Immunization has recently made further recommendations regarding children and youth. Youth aged 12 to 17 who may be at high risk of severe outcomes due to biological or social factors should get a booster dose. This includes youth with an underlying medical condition, and these underlying medical conditions would be chronic lung, liver, heart, or kidney disease, cystic fibrosis, substance abuse disorders, or immunocompromised. Also, youth who live in congregate living settings such as shelters, group homes, or correctional facilities are recommended to receive a booster 6 months after their first 2 doses. Youth in this age group who belong to racialized and marginalized communities disproportionately affected by COVID-19 should also receive a booster. NACI has strengthened the recommendation as well for children aged 5 to 11 years of age. Based on real-world evidence, NACI recommends a complete series with Pfizer should be offered to children aged 5 to 11 who do not have contraindications to the vaccine, with an interval of 8 weeks between doses. Also, children in this age group who are moderately to severely immunocompromised should be immunized with a primary series of 3 doses of Pfizer vaccine, with 4 to 8 weeks between each dose. We are learning more about the importance of getting our booster doses when we're eligible. 3rd doses provide protection against severe outcomes, including hospitalization. And receiving a 3rd dose is especially important for anyone who is immunocompromised or over the age of 50, because the risk of needing hospital care related to COVID-19 is greater. As of January 30th, 22,000 people aged 50 and over were eligible for a booster and have not yet received one. This means that 1/3 of people over the age of 50 have not received their booster. This is too many people at risk of being hospitalized due to severe outcomes from COVID-19. There are over 2,000 vaccine appointments available this week across the province, including appointments for 1st, 2nd, and 3rd doses, and a number of appointments for children. There are special walk-in clinics for booster doses in Charlottetown and Surrey, so there's not a shortage of appointments. Please make it a priority to get vaccinated, including your booster. You might be very glad to be fully vaccinated, including your booster, should you or a loved one contract COVID-19. We received 200 treatments of Paxlovid in late January, and we'll be expecting 200 more in February. This is the first oral antiviral for COVID-19. In partnership with physicians and community pharmacists, a process has been developed to ensure those individuals most at risk of hospitalization receive priority access to Paxlovid. Individuals are a candidate to receive this antiviral if they develop symptoms of COVID-19 in the last 5 days and tested positive for COVID-19 and meet certain criteria that puts them at higher risk for severe outcome, including hospitalization. And this would include those 18 years of age and older with underlying medical conditions, regardless of vaccination status, age 80 and over, regardless of vaccination status, age 60 and over whose COVID-19 vaccinations are not up to date. By reducing the risk of someone with a confirmed diagnosis of COVID-19 from progressing to severe outcomes, including hospitalization or death, Paxlovid can help to reduce the pressure on our healthcare system. And while the availability of Paxlovid makes effective home-based care possible, it is not a substitute for vaccination or public health measures. Yesterday was the first day of school in 2022 for PEI students and staff in person for grades K to 12. Our top priority is for students and staff to return to in-class learning as safely as possible, and it has been. It's important that we take every reasonable step to support the reopening of our public and private schools. As we outlined last week, there are enhanced measures in place to support the transition back to school, students and staff having access to safe and effective vaccines, regular testing, masking, cohorting, physical distancing, enhanced cleaning, daily active screening, and ventilation. There are plans in place to deal with situations when there are positive cases of COVID-19 in schools. Safety in schools does not mean they are COVID-free. We expected there would be some bumps in the road as children and students resume in-class learning. As of 8 o'clock this morning, I am aware there were exposures at 2 schools yesterday, Glen Stewart Primary and Ellerslie Elementary School. I would like to clarify the difference yet again between an exposure notification and a close contact. The education system will send an exposure notification to families if their child was in the same class or school cohort with a positive case. The letter will ask for the child to be monitored and advise that there's no need to self-isolate. The letter will also inform families that after further discussion, their child may go on to be identified as a close contact. And a close contact is someone who has face-to-face interaction within 6 feet of a person with COVID, indoors for at least 10 minutes over a 24-hour period. If both individuals wore a mask during the interaction, it is not considered a close contact situation. In the school context, close contacts might include friends eating lunch together, unmasked, seatmates on the bus if masks are not worn properly. Children and staff who are named as close contacts will be required to isolate for either 4 days if fully vaccinated or 7 days if partially or unvaccinated, and test at a health PI clinic before leaving isolation. They'll be asked to avoid high-risk settings for a total of 10 days from the beginning of their isolation. It is important that parents and staff make it part of their routine to use the rapid screening test 3 times per week. This screening provides an important layer of protection for the individual and others in their class and school. And parents and guardians are asked to keep their child home from school if they are not feeling well or have symptoms of COVID-19. We continue to monitor key indicators, including our 7-day average of new cases, the number of facility-based outbreaks, the number of unlinked cases, the vaccine uptake in all our age groups, the number of hospitalizations and ICU admissions, and the proportion of tests that are positive, or the percent positivity. As I mentioned earlier, the next couple of weeks are very important. While we have population-level measures in place, such as gathering limits and screening at points of entry, we each have a personal responsibility to take steps to protect ourselves and others. We make decisions to wear a mask when in indoor spaces and outdoors if physical distancing cannot be maintained, to get vaccinated, including our booster when eligible, to stay home when we're not feeling well, to assess our own level of risk and that of others when deciding to attend an event or gathering. While we are not in a position to further ease measures today, next week we will be sharing details about how we plan to walk out of this wave and gradually resume living life more normally. And mentioned earlier, hopeful and optimistic, and of course, if the epidemiology supports us, we will begin increasing gathering limits and reducing travel-related isolation later this month. This whole pandemic has been challenging for everyone in different ways. And while we talk about walking out of this wave at times, although tired and weary, I know we all want to walk out of this pandemic as fast as we can. And most of us preferring to run out. And frankly, I feel like I'd like to sprint out of it. But the reason we continue to do this job, and the Premier sits here as well, the reason our team is doing it is that we care about the health of this population, and we care about what happens to Islanders. So we will continue to take a steady, balanced, and measured approach, making adjustments based on our local, national, and international data and our evidence as we do come out of this pandemic. So as we navigate through this challenging time, always aiming to balance the risk of COVID-19 with measures to minimize disruption in the province and protect our healthcare system. Let us continue to be patient and continue to be kind. Okay, thank you.
Thank you very much, Dr. Morrison. Appreciate that sentiment. Every time you say it, I think it means more to me and Islanders, but it's great advice as always. So with that, I'll turn it over to questions from our friends in the media. We haven't seen him for a while. Maybe we'll start with Wayne Thibodeau from CBC and make our way back from there.
Dr. Morrison, if I can start with you, I noticed you mentioned in the case counts, I think if I got the numbers correct, 362 versus the average around 250. So we're seeing a bit of an increase today. Can we make the connection that may have something to do with the return to school?
I think that would be early. I think we've seen some of that increase happen on Mondays, and it's hard to know. That's why we don't base decisions on one day. We look at the trend and that importance of the trend over 7 days. There was no testing for one day on the weekend. For some difficulty even accessing a test on Sunday morning because of the weather. So whether that had to do some with the storm and the weekend, there may be some indication if people were testing with antigen tests more before they went back to school. It may have prompted some additional testing yesterday as well. So I think we'll also see what happens today.
You mentioned, and we saw on the public schools branch website, 2 schools now with COVID-19. And can you explain to me, because I know there are some parents obviously who are concerned about bringing their kids back to school, about the decision to keep schools open as opposed to closing them when we see COVID cases in schools?
Well, I mean, I think it's part of what the whole country is doing too. We're trying to make sure there's multiple layers of protection there. We know the importance of being in class learning. We have trying to still make sure, and we're one of the provinces that is still trying to do that in terms of identifying close contacts. We know that the risk is highest among those who are the closest contacts. And so that's why we have multiple things in place. And I mean, even from my own household with 4 children going back, mixed feelings, but I certainly have wanted to reemphasize with them the importance of wearing their masks in school. If there was and it's only a matter of time before, with 4 of them, that one of them will be a close contact or a case, and but trying to make sure that they doing all those measures, but I'm not worried about sending them to the class.
Is there a point in time where you look at closure of schools?
So we have set it up, and we talked a little bit about it last week, where we have a team of folks with the Office of the Chief Public Health Office, as well as a group working with the Public Schools branch, for instance, and those in the school system, where there'll be risk assessment done, and some of it will be operationally. I mean, when there are, for instance, might not be enough staff in a school system, but we'll be looking at the numbers of cases, but there certainly wouldn't be school closure based on one or two individual cases.
I just have one last question, and it's with regards, you mentioned it, I think, twice about next week. We're hearing a lot of feedback from Islanders about the 4-day isolation. They want to travel, they want friends, family come over. Can you explain to us a bit why we can't ease that restriction now? We know that sort of the travel restrictions were in place to keep COVID out, but with widespread community spread, the case counts as high as there are, why do we still have that restriction in place that you have to isolate for 4 days if you come to PEI?
So, I mean, and I think Newfoundland has had that same isolation and still has it currently, but they also will be looking at reducing that isolation period. We've been tracking how many positive cases that we get at our points of entry, so right in almost every week since Christmas, there have been 200, 250 cases identified just at the points of entry. And with each of those cases, likely to infect a minimum of 4 other people on average with Omicron. That would be an extra 1,000 plus cases per week in the province. And that doesn't include the additional number of people who then would test positive on during that day 2 to day 4. So it's been serving an important purpose, especially as we're trying to limit transmission here. But what we'd like to do, certainly before the end of the month, is to drop the isolation component of it and just have the testing remain. So that would be the next step. But certainly you can see why that's been an important part of minimizing how the impact of bulk of cases here in the province.
And the key about next week being you'll just have more time, or are you starting to see those numbers dropping at our points of entry?
Well, I think a lot of measures changed. We got children back to school. There was easing up of measures yesterday, and so it's really it's so that we can not do everything all at once, and that if we talk about outlining it, and I think the Premier has talked about it, I think we all want to have a bit of a roadmap that's a very simple roadmap to help us step out of this like the rest of the country. So I think we'd just be better prepared to talk about it next week.
And it will happen next week or might happen next week?
Look, I think it's fair to say that, we understand that Islanders, probably more so than ever before through COVID, need to see that roadmap and for it to be an achievable plan for us. It's probably more important now than it's ever been. So, we can begin to talk about how we ease our way out of that. There does seem to be information nationally that we've crested nationally, and so whether or not we have here or not, we're still trying to determine. Our numbers are trending in the right direction for the most part in terms of the factors that we look at. So I think, in some way, shape, or form, we will talk about what the middle of the 3rd week of February looks like and beyond that and what it looks like. But, Dr. Morrison has quietly said to me before, or she said it on here before, that certainly by Easter we should be through this. I don't want to hold her through that completely, but that's sort of where we seem to be trending here for sure. This is based not on, as important as everyone's opinion is, and you have to be cognizant of that, me more so than Dr. Morrison for sure in the job that I'm in. But we've had people saying we want no rules in school. We've had people saying I'm apprehensive to send my kids with all the rules we have. So this can't be about a public relations exercise. So it will be, we're mindful of everyone's opinion, and everyone's opinion certainly matters, but we have to continue to take these cautious steps as we're taking based on the trajectory of our indicators, which seem to be good, but
So You have the third week of February circled on your calendar, potentially for this 4-day isolation to be
Yeah, well,
limited.
we have been talking about, really since the beginning, we've been doing a lot of these things on 21-day increments. So that's essentially what we're looking at. If we're able to go faster, we certainly will do that, but it will be based on that. But we seem to have a good, consistent approach by doing this on 3-week intervals. That gives us new information to base our decisions upon, based on the projections that we've seen, what we're seeing nationally and regionally. And so it would be certainly our hope that by then but we'll start to talk about it next week. I mean, people deserve to know where we're at and where we're going. And it's as much as there's science to this, it's an unrefined science sometimes, but people need to know what the roadmap is, and we're going to do the best we can to provide it.
Thank you.
Thank you, Wayne. Allison from The
Yes,
Guardian.
Alison Jenkins, The Guardian. Just wondering if there's any plans to put vaccination clinics back in schools eventually?
So I think, Allison, we've been talking about that. Obviously, there was a real need for the clinics to be in the community and are really pushed to try to get as many people vaccinated, both boosters as well as our younger people vaccinated. And I think now as they may be more look more individually at certain schools or certain communities where they need to put more emphasis. And I think it's probably worth mentioning there's the consolidated schools. Sometimes it's difficult to look at the schools that because they're consolidated in certain regions of the province versus just a pure high school or a junior high. And when you look at the 5 schools that have the lowest levels of vaccine, they're either all elementary or consolidated schools. So it sort of speaks to the versus a high school. So I think that's just one comment. And out of those 5, there's 3 that are in urban center and 2 of them are in rural area. So it's not just one part of the province. That those are across.
Thank you. Yeah, that was one of the questions that I won't ask is access to vaccines at the ends of the island for kids. Well, perhaps I will ask. Have you seen, you say that it's evenly distributed. Have you seen any booster issues or vaccination issues at the ends of the islands where, it might be harder for people to get access?
I think that's a good question. I don't have that information, and I think there's some challenges with, but they're looking at, can they pull some of that information as opposed to just by age group? Can they do some of it by postal code to see? We have certainly had good uptake across the province. We have over 57,700 people who've had their boosters, just to give you a sense. And we have over, I think it's 86% of those age 80 and over who've had their booster, 78% of those in their 70s, 66% of those in their 60s who've had their boosters, and 46% of those in their 50s who've had their boosters.
And I would just add, Allison, to that. I don't. When I talk about some of the unrefined parts of this, I don't think you can just look at this and say the further you go to the extremities, the less the uptake has been. So from our perspective, if it's about access, we can work and will continue to work on making sure that there's access as much as we can. If that can occur in School A, for example, then that would be great. But making sure that access is there to community. I have no doubt growing up in where I grew up, sometimes it's not, although Georgetown is close to Montague, it's not easy to get there some days. So there might be some challenges around the transportation component of this. And it's been sort of highlighted also that, when we didn't have schools open, perhaps we missed an opportunity to be utilizing schools for that vaccination for sure. But those things we can deal with from a logistics perspective. And whether or not there's a hesitation or whatever, those are things we have probably less control over. So we've been working over the last couple of weeks to make more clinics and spaces available for vaccinations all across PEI as well, and and I expect the uptake will continue there for sure. We talk often that we've been in lockstep pretty much with Newfoundland and Labrador the entire time. And now Newfoundland and Labrador is 10 points ahead of us on the 5 to 11. And both Dr. Morrison and I take that a little bit personally. So we have to figure out how we can catch up as quickly and look at, some of the things that we can do in that regard. But, I would again say the uptake of vaccine in PEI has been incredible. And I think when those spaces become more available and people realize that our way through this safely and to limit the severity of the impacts of COVID is through vaccinations, that those numbers will continue to grow.
Okay, thank you very much. I have a couple questions about Paxlovid. I was distracted when you mentioned the doses that we were getting. Are those all assigned to people, or are they going to be available to people?
So yeah, there's 200, really it's, I may have used doses, but there are 200 treatment courses. So 200 people who could access Paxlovid this month, and then another 200 doses coming in February and 500 in March. And what is happening is anyone who is identified as a case of who's tested positive for COVID, who has symptoms within the last 5 days, and sort of some of the other conditions, and they don't have contraindications. So there are some drug interactions and contraindications. They are being referred for consideration of this antiviral, and eventually, it will be able to be prescribed by every physician, and it'll be available in every pharmacy. But with only 200, enough for 200 people coming in this month, we're trying to make sure those who may be at highest risk of ending up in hospital have a chance to get it. So there's a group of, a hub of prescribers and a hub of pharmacies that have been identified across the province, and that information has been shared with home care, our callers who are calling everyone who are 50 years of age and older so they can screen, physicians, nurse practitioners.
And I had one more quick question. You had said that one of the groups that is in that priority group is 60 and over who are not fully, who the wording was not fully vaccinated. Mm-hmm. And I was curious if that means, behind on their vaccinations, not up to date on their COVID vaccinations. Does that refer to they're not yet boosted, or they only have 1 or 2 doses? Does that include the booster?
So good question. The way it's written is really anyone who hasn't had their first or second, but really we're being, if they're tested positive and they have symptoms and they're in that age category, they'll certainly, especially if they have any underlying health condition. It's just that they know that Paxlovid, not being fully vaccinated, puts people at a bit higher risk of ending up in hospital. So we would want to make sure we try to reach out to those folks.
Okay. Thank you very much.
You're welcome.
Bonjour, to
Bonjour.
you both. Bonjour. Today I'm going to just focus in French. I'm sorry for you, Premier. Dr. Morrison, je voudrais savoir, vous parlez de la suite, du futur, de changer encore les restrictions, etc. Aujourd'hui, on voit les chiffres qui remontent, les hospitalisations sont toujours aussi hautes. On peut dire que ça fait un peu un yo-yo en français, on dirait, si vous connaissez l'expression. Qu'est-ce que ça va prendre pour que la semaine prochaine, vous reveniez ici devant nous et vous nous annonciez la levée de nouvelles mesures?
Alors, bonjour. C'est important qu'on regarde pas seulement en journée, on parle des trends. Et puis, on ne regarde pas en journée des cas, mais on regarde les cas par jour pendant une semaine. Même chose pour les nombres de personnes à l'hôpital. Et on regarde aussi le nombre de outbreaks, pas seulement un jour, mais pendant la semaine. Et on regarde aussi le nombre de personnes qui sont vaccinées. C'est important. Alors, c'est toutes les indications ensemble. Et Et on discute avec l'épidémiologiste et puis on discute avec les autres collègues ici aux région Atlantique. Et on voit qu'est-ce qui arrive vraiment au Canada. Alors, tout ensemble, j'espère que ensemble, on a fait tout ça ensemble vraiment. Alors, on va continuer ensemble. On va regarder comment on peut changer vraiment du pandémie jusqu'à endémie. Mais on a parlé de ça avant et qu'on peut vraiment vivre avec COVID. Alors, j'espère qu'on peut être sur une place d'en discuter la semaine prochaine pour les mesures qui arrivent un peu plus tard en février.
Vous pensez vraiment qu'on va passer en une endémie, que vous venez de me le dire, pardon?
Ouais.
Est-ce que vous pensez qu'on y est presque?
Pas 7 mois, mais dans quelques mois, oui. J'imagine le printemps, on va faire un changement à cette place.
Les écoles ont réouvert hier. Il y a déjà eu quelques petites alertes dans des autobus et dans des écoles. Jusqu'à quel point vous allez laisser les écoles ouvertes, laisser les élèves à l'intérieur? À partir de quel moment vous allez vous dire trop de cas, trop d'éclosions, on retourne en arrière? Quelle est votre limite?
C'est une bonne question et puis on en discute souvent. Alors, on va faire, chaque fois qu'on regarde les cas, on va regarder chaque jour vraiment le nombre de cas. On va discuter avec le Public Schools Branch ou Commission scolaire en français. Et puis, des fois, ces décisions sont plutôt au niveau d'école, s'ils peuvent se fonctionner. Mais si on pense qu'il y a trop de cas, peut-être on fait la recommandation de fermer, mais on veut pas faire si on n'a pas besoin. Et puis, c'est pour cette raison, on a tellement de mesures en place, d'essayer de continuer. On sait que c'est important, mais si on a besoin, on va regarder chaque jour et faire une décision.
Vous l'avez dit, 2000 vaccinations disponibles cette semaine à l'île du Prince-Édouard. 20 000 personnes sont éligibles pour le booster. Comment vous expliquez cela? Est-ce que finalement les insulaires ne sont pas pressés d'avoir une troisième dose?
Oui, c'est une bonne question. Je pense qu'ils ne sont pas pressés. Peut-être qu'ils pensent qu'ils n'ont pas besoin. Alors, c'est pourquoi ça soit ici pour d'essayer de dire qu'avec le booster, ça vous donne tellement plus de protection d'être à l'hôpital. La majorité des cas à l'hôpital n'ont pas un booster. Et c'est pas justement ici, mais partout au pays. Alors, et je pense qu'il y a un certain montant les personnes sont fatiguées, les insulaires sont fatigués. Moi, je comprends ça. Alors, on savait qu'on va pas avoir le même montant, mais on est assez content qu'avec les personnes qui sont un peu plus âgées, que le nombre continue d'augmenter. Et je pense que c'est les personnes qui sont les 50 ans et plus, on aimerait avoir ce nombre un peu plus haut.
Vous me parlez des hôpitaux. Je vais vous poser la question. Je ne sais pas si vous allez vouloir me répondre, mais je la pose quand même. Parmi les personnes qui ont malheureusement perdu la vie de la COVID-19 ici à l'île du Prince-Édouard, est-ce que ces personnes-là ont été vaccinées 2 doses, 3 doses? Et est-ce que vous savez quel type de variant ces personnes en sont décédées? Est-ce que c'était l'Omicron? Est-ce que c'était Delta?
Alors, je pense que tous ces détails vont être, chaque semaine, on va augmenter le nombre de personnes et indiquer ça sur le site web. Mais on avait la majorité des cas ici depuis le mi-décembre sont Omicron. On a eu quelques-unes de Delta, mais je ne suis pas certaine à propos des autres, mais c'est quelque chose qu'on suit, on essaie de regarder, mais je pense juste à propos du timing, c'est plutôt le Omicron.
Ma dernière question, après je vous laisse tranquille. Comment la santé publique explique la hausse de décès si le variant Omicron est moins fort que les variants précédents et à quel point ça vous inquiète?
Oui, alors c'est moins sévère en général, mais on sait que les personnes qui sont plus à risque sont les personnes qui sont plus âgées. Les personnes qui sont à l'hôpital sont 50 ans et plus en général, ça c'est le grand nombre. Et puis, si on voit beaucoup plus de personnes qui sont malades, on sait qu'on va avoir un peu un nombre de personnes qui ont des outcomes qui sont plus sévères. Alors, c'est pas vraiment différent ici de n'importe autre part au Canada. Alors, ça ne surprit pas qu'on a les cas. Okay. Merci, Julien.
Thank you, Julianne. Now we can go to some questions from our friends joining us online.
Terry Campbell, CBC.
Good afternoon. Thanks a lot. I just, for starters, I wondered if you could just walk through so families understand sort of what's happening, the process that we would have gone through with the school exposures that we were notified about this morning. How does that happen? You know, do people get a particular personal notification? Is it different for families that might be impacted that are in those classrooms? Are there kids that don't come to school? All that stuff around how that works.
Hi, Carrie. I think, I mean, some of those questions also could go to the school system, and we talked about some of them last week as well. But if there is an exposure in a classroom, the public schools branch will send out a notification to every parent in that class that there was an exposure, and say that, you know, your child might be identified after further discussion as a close contact, and you'll be subsequently notified about that as well. But if watch for symptoms, increase the testing, and some of that direction is in a notification out to other children and families who were in that class. A separate notification is given out to the close contacts of the case. So we talked about in here what a close contact is, and there's a separate note out to them from the schools as well. Cases themselves are able to determine very quickly or fairly quickly their test results, so that they and I think there'll be some kinks in the next couple of days that we're working out. I know our team is meeting with the school system again this afternoon, and lots of discussions last night with these first couple of exposures. So I think people will know if they're close contacts and be advised. If they're exposure at the school, they will be notified. And the cases, every case that's 12 years of age and under will get a call from public health nursing. And if they have information that with their consent, they will make sure that they communicate that with the school as well. So I think that's what is the intention. That is what the plan is. And we'll work out some of the kinks and communication lines, but I think it's a good, solid plan of with that part of it as well. So I think that's really what you're asking, Carrie, and we'll. I think it'll probably go smoother in the days ahead than maybe it did last night, I think. But that's probably to be expected. And I think there'll be some discussion of making sure everyone's comfortable what a close contact is. So, and I think that will be some of the early learning part of that. For students who are older, so if you're in high school and you're identified as a case, that high school student will still notify the school, and they'll be advised from an exposure point of view, but the high school student would be notifying their own close contacts, just like everybody else in the general public. So there'll be a little bit of a dual role there, which makes sense. The high school student should be able to tell you who they had lunch with, but a child in grade 1 might not be able to identify as easily who they, or the last name. It would be difficult for the family in some ways to reach out to identify those close contacts. So that's why it's more of a combined effort in those younger grades.
Okay, and with these two specific cases today, though, can you maybe just walk through, those schools stayed open. How was that decision arrived at? Is there a threshold or anything? How do you decide if that's not going to be the case, if you're going to shut school down?
Carrie, I think Wayne had the similar question, and as did Julien, so it's a good question, and we are continuing to work with the school system. It's a risk assessment. We've been very clear that we're trying to make sure people are aware. There's multiple layers of protection and in place, but that a single case would not mean that there's a school closure, and we were clear about that last week. Some of the decisions around school closures will relate to actual operational constraints, so that really would be a decision of the school system on their own and the public schools branch. So it'll be a shared decision between the Commission, the public schools branch, or administrators at private schools and our office when that happens. But we are looking at we'll be looking at the information daily regarding that. And similar to early learning centers, some of them have had cases or outbreaks, and they're making a lot of those decisions and informing us.
And I wonder if I might just get you some more thoughts and maybe some specific actions, if you have any, on the topic of the vaccinations among the 5 to 11-year-olds, because even if you look among the elementary schools themselves, those numbers that were released on Friday, there's a really wide discrepancy there. O'Leary, 19% with a first dose, that is the lowest, compared with 75% at Stratford Elementary. But it's not even a regional thing, because if you look here in Charlottetown, St. Jean Elementary, that's the second lowest, 30%. I know we were talking this morning with the MLA for O'Leary and Inverness. He doesn't think that it's necessarily a lack of access to the opportunity to kind of book those appointments. I just wonder if there's any specific actions you might take. He thought maybe some outreach up in his community around the benefits of vaccinations more than just what we've been getting, I guess, which is kind of the opportunity to book appointments and just kind of weekly notifications around how important that is. With the high schools, we seem to have more uniform vaccination rates, and I wonder if that might be tied to, providing those in the schools. Any thoughts, any concrete actions you think that might be taken, either of you?
Look, I can start. I think that I do think that, like you as a parent myself, I suspect there is some more hesitation or apprehension around vaccinating younger kids than teenagers. I think that is natural. I think, and we've said this before, if we need to go into school A and to try to offer vaccination in that particular school, that's something that we can work with Health PEI to try to do. I don't know from an educational perspective or a public relations perspective what more or how much more we can do sort of promoting the vaccine. I think, I think we've been pretty consistent, and most people across the country know the importance of that vaccine and how it can reduce severe outcomes, and it's really our best way through this. I think we've been all looking at those numbers over the last couple of weeks and saying, what more can we do? Is there any consistency with why School A and School B are this and School C is that? So it really continues to be a work in progress. If there's something that we can do to, lessen some hesitation or concerns, I think we try to do that on a daily basis. I say if access was the issue, it would be easier to define and easier to fix. But I think we're just trying to do our best to explain why everyone should have this and continue to work on that. Dr. Morrison, would you?
No, and I think, Carrie, the other thing is that those numbers were done, put together for the schools a couple of weeks ago now, so that they're going to be updated the week of February 7th. So I think you'll see a difference in some of those numbers because they will have had more opportunity to get their vaccine. I think some of them may have been, some individuals and families may have been waiting for some of the school-based programs, and when school wasn't in class learning, they had to book in other clinics. I do think there's just to clarify. The schools, public health and nursing went into junior high schools, but they did not go into high schools, just to clarify that. And I know that they are actually working with some of the communications folks in terms of trying to get some different messages out on social media and other venues. And there are people that are really good at that, and so they've been that's being launched. So I think that also may help, and I think. To your point, Carrie, public health nursing has always played such a big role in school-based vaccination programs in this province, but childhood vaccinations in general, and that's why I think Newfoundland has a similar kind of model, and that's why we tend to have very good childhood vaccination rates. And so even some of the looking at certain schools that they need to may be something that they have to do as well. So it's a combination of all those efforts that the Premier mentioned, and as well as some of these things going forward.
Thank you very much.
Thank you, Carrie.
Natasha, CTV Halifax.
Hi, this is our colleague, Corey. Natasha just stepped out for the moment. So we just have one question. Yesterday, Saskatchewan Premier Scott Moe questioned the effectiveness of current vaccines in preventing the spread of Omicron and said that proof of vaccination will end very soon in that province. You mentioned PEI may start to loosen restrictions this month. Is this something you are considering?
I haven't talked to Premier Moe about vax passes or anything like that. I think we have indicated here that we are hoping to lay out a roadmap of how we get through this once we get through the peak. But I really don't think we've gone as far to say, what that extent would look like beyond. I think we would be talking about things like ending the 4-day isolation for those coming across or coming into our province. And as Dr. Morrison said, getting sports teams back to playing games and other activities such as that. But, we haven't gone as far to say that we're looking at anything beyond that. Dr. Morrison, anything to add?
No, I just think in terms of our overall measures, certainly a lot of these, it would be one of the other measures that will be phased out over the next couple of months, but it wouldn't be the first thing that we're trying to address as our first step.
Thank you.
Thank you, Corey. Wayne, you indicated you might have another question.
If I could squeeze in, probably best to you, Premier, but if Dr. Morrison would like to weed in as well. We saw wall-to-wall coverage of the protests in Ottawa over the weekend. We've seen protests out here today. I know that's not unusual. I'm just wondering if you feel that these protests may be having an impact on the uptake of vaccinations and boosters, and maybe even eroding some Islanders' confidence in the vaccination process.
That's a hard question to really answer, other than just anecdotal thoughts that individuals or that we might have. I prefaced the news conference here, but we understand how tired everybody is. I've heard more than one person say to me, I've done everything I'm supposed to do and I want to be done with it. So we understand all of that. So, look, I think the longer this goes on, obviously, the more and more people get tired of it. But I think it's one thing to talk about people being tired and want to be done of it, and then talking about people who are, whether they're anti-vaccination or anti-lockdown or things like that. So it's hard to put everybody in one, to pigeonhole them into one particular box. I mean, I have to believe there were people in Ottawa this weekend who genuinely just were trying to support truckers and wanting to make that easier. I don't think everybody there was, ridiculously, opposed to a lot of things, although a lot of the coverage did indicate that. But whether or not it erodes public confidence, I don't know. I think it's probably more symbolic or reflective of just how long this has been going on. And as I have been saying that, we've been doing this for almost 2 years. This is not how we live. Nobody who's alive today has had to live go through what we have had to go through and live what we have lived. So it's obviously tiresome and it's difficult, and any adjective you want to use, it's extremely frustrating to have to do this. But at the same time, we're not just kind of sitting here doing this because we get any particular joy from doing it. We're in a worldwide health pandemic that has killed millions worldwide, that has killed hundreds of thousands on the continent, and 40 or 50,000 in Canada, and now 11 here in PEI. And so it is a serious thing. We're doing this for a reason. But we don't want it to continue any longer than we have to. I think I have to also believe that the people who are outside today, I don't think they're bad people. I think they're frustrated and they want to voice their views and support their right to do that. But at the same time, if you're in the chair that I'm in and the one Dr. Morrison is in, we try to take the best science and information that we can to develop it into policy for the public at large. People take that view, and when they take that information, their view is a very personal view of how will this impact me, how does this impact my family, my community. But it's really, really hard to develop public policy for an individual family or a group. So you try to do the best you can for the broad group. You try to triage to the best you can. If we do this, who might be impacted, and try to tailor some programs to help those that are impacted. But there's absolutely no way to develop a back-to-school plan, for example, and know that an individual lives with two of their grandparents who are immunocompromised, and what indication or what implications that might have by going to school and taking that back home. So, it's really, really difficult from a public policy perspective to do something for a broad group and have, the nature, the human nature is to read it and think about it from your own perspective. So it's really difficult. You have to be mindful and try to figure out what that is, but it's a challenge, and I understand the frustration and that. I'm frustrated by it. My son's going to hockey for the first time tonight, and I'm not going to go, and that frustrates me. That bothers me. I want to go watch the Islanders. We have the Islanders, the Capitals, the Panthers. We have the best hockey that we've had in 15 years here, where the three teams are going to make championship runs and they're not there. So yes, I'm frustrated. I understand that. And I want to end this as well as anybody. But, it's sorry for the rant to a simple question, but I don't know. The answer is I don't know. I hope not. I think most people are reasonable. Most people understand. And the fact that we've had 94% of Islanders get vaccinated and follow the rules to the extent we have, I think shows the tremendous uptake we've had here. But, you know, we couldn't get 100% of us to agree on what color the sky is today, and it'd be foolish for us to try to develop a program that would be aiming for that, so.
Yeah, I mean, I agree. I think, you know, we said it earlier on that this pandemic and this last couple of years have been challenging for everyone, and then challenging sometimes in different ways. I think overall, it's hard that at this point in the pandemic, the hardest part for PEI in this pandemic is happening right near the end, because really we have not experienced the hospitalizations, the deaths, and the ICU admissions that almost everywhere else did, and the outbreaks throughout this pandemic. And I think we have to remember part of that, but we're trying to protect everybody as best we can through this last really rough stage. But as the Premier said, we all want to transition as quickly as we can, as safely as we can out of this, making the decisions that we can at a population level. And that's really what public health is. It's looking at what decisions can you make at a broad level that will try to protect us all. But it is really hard.
Thank you both.
Well, thank you very much, Dr. Morrison, and all Islanders, thank you very much, and to our students and teachers and parents and just bus drivers, just keep up the good work and make these cautious steps together. So thank you very much.